it's been a hot minute since I've done or I've been consistent with the Q&A sessions, but we're about to have lunch and 3:75, so you know what that means. Another lunch, another Q&A session. Yesterday I couldn't do it because I was where was I was getting lunch already. I went out for lunch. I was meeting someone, so had lunch then. But yeah, today it's just me by myself, so we're gonna do a lunch Q&A session, so you know how that shit goes. This is where we eat the standard stuff. Nothing has changed, so if you are a regular here, you know exactly what is about to go down. So if you can tell me what's gonna go down, that would be great. And now, okay, looks like we already got something rolling in here. SRI Gator, Sri Gator says, does guanfacine make you groggy? It can, not as much as clonidine. However, it can cause some grogginess for sure. A lot of people definitely do experience that grogginess. So that's why I'll tell people if they feel groggy to take it at night. Otherwise, taking it in the morning is fine. You're gonna notice more of a benefit in the morning rather than at night. For sure, you're gonna notice more of a benefit in the morning rather than at night, especially if you're trying to treat daytime impulsivity. But at night can still be effective. Or you can always have a higher dose at night and a lesser dose during the day. So all of those are options. Awesome. Yeah, so if you like this, definitely double tap the screen to like it, and that way we can share this live more with other people. How many pieces did I put on? So 1, 2, 3, and then this one's the 4th. So I think this should be enough. What should I expect to notice a difference? With what exactly? If you up your Lexapro dosage, can you be more anxious at first while you adjust? Yeah, actually. So there's a thing, it's called like the activation effect. And basically it's thought that with SSRIs, they can activate or energize people, especially near the beginning. And that can contribute to some anxiety, especially near the beginning. Bearded Radiant says, I started Luvox about a week ago, first starting at 25 milligrams daily and started 50 last night. Oh, okay. So usually about 300 is the max dose for Luvox. So yeah, 25 is 50 is like a small starting dose. So that's totally fine. You just have to give it time to let it cook, basically. Also, I've been taking Chat's advice to start thawing out stuff. So at least this morning I started thawing out my broccoli and chicken. But the salmon I did last night, so at least that was, oh shit, I gotta olive oil this. When do people commonly notice a difference? What mg? Usually around like 150 is, I think, a good benchmark to reach, especially for OCD treatment. What do you sales? So, I mean, I'm not sure what that means. What do you sales? What do you sell, maybe? So I run a nurse practitioner coaching community, and I'm also a psychiatrist, so I see patients. Meds for OCD and bad anxiety. Meds for OCD and bad anxiety when SSRIs and benzos do nothing. Well, it's hard to say whether they don't do anything because I don't know what dose you tried. I don't know how long you tried for. Oftentimes, I find that people don't stick with things long enough to notice the benefit. To say that they do nothing, you have to be on a good dose for an extended period of time. Like, you can't just do it for a couple days or a week and say that it doesn't do anything. Mix it up, eat something different. Yeah, yesterday I had tacos. Like, yesterday I went out for lunch, and so I had taco. I had like steak ribeye tacos. I had tuna tartare. I had this like cookie dessert thing too. That was yesterday, you know, when I go out. But when I'm at home, I eat the same shit every day. It doesn't bore me. And I like knowing pretty much exactly, I like it. It keeps my mind sharp, like the omega-3s. It keeps my body good too, right? Helps maintain physique-wise. I know calories and protein I'm getting in. So once I like something, I just execute on it. Right, got some of the chicken. I started thawing it out. Got some of the salmon as well too. So we can start opening and seasoning this. So good, I'm glad that this bitch is thawing. It's helpful. Let's see now, let's see how it will open. Okay, so the oven is ready. Hey, my girlfriend of 5 years broke up with me. I feel like a hopeless schizophrenic. I remember answering, I can't remember if it was your question I answered or someone else's, but you know, a girlfriend breaks up with you, that's your chance to level up. Like the last time I had a breakup, I got broken up with, that's when I was going to the gym at like 5 a.m. That's when I started TikTok and social media. So like I really focused my energy on leveling up rather than like pining after my ex. And you know, she actually came back and we saw each other again for a while. So if you level up and you focus on that, you know, either they'll come back or someone else will come in your life. But either way, you win. I think the mistake that most guys make is and just people in general, is they get too wrapped up in their exes instead of getting more focusing on themselves. They're trying to put me on Abilify for anxiety, but I feel that would make it worse. What do you think? I agree, actually. I do think Abilify can worsen anxiety. It's not really meant for anxiety. It's meant more for depression and mood stability. There's different options for anxiety specifically. Abilify can also be stimulating, so that's the problem with it. That's why it can worsen anxiety for some people. All right, so I got my 2 pieces of fish. Pharmacist from Australia, what up? Nice, what up, bro or girl? Okay. Also, be wary of a loud noise. My Roomba has just landed in its docking position. As I mentioned, be wary of a long... Oh, I forgot to weigh that out. Let me wash this hand. I've started slacking with my weigh-ins, but I always find that when I weigh the food is when I do best with like physique goals. So I need to get back into that. You know, like actually just keeping track of everything I eat has been the most important thing I've found. 183, 280. Okay, so about 300. Okay, that's really good to know. So I'm having about 300 grams of chicken and about, this is about 700 calories worth of salmon. So it's about 1,000, 1,200-ish. So this will keep me pretty full. Yeah, I mean, this isn't something for ED people, right? I do it for myself. You know, I wouldn't recommend calorie counting if you have ED, but, right, if you don't and you're trying to maintain a good physique or you're trying to lose weight or maintain, I found that counting has been the most important thing for myself. Otherwise, like, it's hard for me to get leaner. Or like I'll overeat. What's the hardest mental illness to treat? Probably PTSD, to be honest. I think that's the one where medications are not as effective as we would like them to be. But they're all challenging in their different ways. Hoarding, I think, is very difficult too. OCD, I think, is difficult. Yeah. Some of the stuff that there's not many medication options, that can be difficult as well too. Like functional neurologic disorder can be very difficult. Rock hard meat, lol. Yeah, I didn't fully thaw it, unfortunately. Okay, let me put some garlic on here too. Top 5 mental illnesses hardest to treat. I mean, there's only so many, but I think PTSD and OCD are some of the harder ones. I mean, treatment-resistant schizophrenia can be hard. Personality disorders are hard too, like antisocial or borderline can be difficult. Addiction actually is very hard as well, because the person has to really, there's no like med that can really help. I mean, it can somewhat, but the person has to really want the treatment. Does NAC work for anxiety? Yes and no. Does NAC work for anxiety? Yes and no. It works more for OCD, but you know, if you're treating OCD, then I consider anxiety like a lesser form of OCD. So yes. Yeah, I like NAC a lot. It's one of the ones I prescribe most often. And the reason is because it helps with inflammation and helps create glutamate, which helps decrease inflammation and reactive oxygen species. I actually just talked about this yesterday in my nurse practitioner coaching community. We had our weekly coaching call and actually just talked about how NAC helps glutamate production, and glutamate helps our body detox. So that's why N-acetylcysteine is really good for mental health conditions like OCD, because it helps the detox from all the inflammation. My wife washes her hand excessively. Is that normal? You know, I don't know how much excessive is, but it can definitely be considered a sign of OCD is excessive hand washing. All right, I think I've seasoned the shit out of this thing. But other than that, time to just put in the oven. Ooh. Gotta take the spoon out. That would be ideal. I don't think the seasoning's gonna stay on the broccoli here, but whatever, we'll try. Just because it hasn't been fully dried out. It's still a little bit frozen, but whatever, fuck it. You eat the same thing every day? Every day I stay at home, I will eat the same thing, yes. Okay, and then time to set the timer. So, timer of 25 minutes should be good. What salt do I use? I use the Himalayan salt. That's what I use. Are you practicing for a cooking show? No, this is just when I do my lives, is when I'm cooking. You know, because they say that sharing a meal with people bonds people together. So, yeah, if I get to share a meal with you, it's like we're almost in the same room chatting and vibing. Also, who else is eating lunch right now, just out of curiosity, or about to have lunch? Okay, so hands are washed. Also, yeah, what are you eating for lunch if you're having lunch? I eat the same food just because I like it. I don't get bored of food. For me, food is like macros, calories, proteins, etc. So I found a good system that works for me, that keeps me healthy, keeps me fit, keeps my brain sharp. And yeah, so that's why I eat the same stuff every day. Do you think it's better to up my 10 milligrams of Lexapro to 15 or add my 150 Wellbutrin to my Lexapro? It depends. So if I'm trying to target more depression and ADHD, I would look at adding in Wellbutrin. But if I am just trying to address more anxiety, depression, I'll try to optimize Lexapro. So it depends what I'm trying to target. Do you lift? Yeah, I just did shoulders, arms this morning. What temp is oven? It's at 375. Gonna do 375 for about 25 minutes. Best supplements to help anxiety: L-theanine, magnesium. N-acetylcysteine, especially for OCD. Saffron is helpful as well. Wait. I thought I ran this. Oh shit. So I thought I ran the dishwasher, but stuff appears dirty, so it may not have been run. I thought I ran it last night. But clearly not. So, therefore, I will need to run it today after I finish my live. How much magnesium glycinate can I take for anxiety? Like 150 to 500 milligrams-ish. Magnesium, there really is no upper limit. People are limited by magnesium only if they get diarrhea. So you can generally take a lot of magnesium and it's pretty safe. There's some cardiac risk as well, but it's rare. It's a rare risk. Man, my Roomba is kicking. Like he or she is working like a dog, just cleaning up everything. I've had her going since the morning and she's still hustling. Best treatment for BPD, my mom, so the best treatment for BPD is called DBT, or dialectical behavioral therapy. And basically what that does is it helps with mindfulness, emotional regulation, distress tolerance, etc., etc. That's the best treatment for BPD. What is your advice on stress-lowering cortisol? I go to the gym and now have my summer off. Yeah, so you can take ashwagandha. Ashwagandha is really good. Meditation, sleeping a lot. Sleep has helped my stress levels more than anything. Does Wellbutrin commonly cause high blood pressure? So thank you for the sub, Graceful. So remember, if you sub, it lets me prioritize your questions more than other people's. Because they'll stand out, especially because we have over 100 people in here. So they will stand out more than everyone else's. So definitely look at that. Like, for example, Graceful has. So Wellbutrin doesn't commonly cause high blood pressure, but it can increase people's blood pressure because it's stimulating and it helps with norepinephrine and dopamine increasing. Can you please share your schooling journey? Yeah, so I went to University of Alabama at Birmingham, UAB, for college. Then I went to South Alabama for med school, and then I went to Western Michigan for residency, and then I went to fellowship at Northwestern or Northwell in New York. So yeah, and I finished my child fellowship last year. Also, just out of curiosity, so who here is a if you're a provider, like an NP, physician, etc., say 1. And if you are a patient or like a general person just interested in mental health, say 2. Yeah, provider 1, general layperson, say 2. Interesting. So we have 1, 2, 2s, 1.5. Interesting. Okay, so we have a good mix here. So if you're a 1, what kind of provider are you? Like, are you an NP? Are you a physician? Like a counselor, a therapist, etc., etc. LCSW, FNP, critical care MD, therapist. Interesting. We have such a mix here. Such a psychologist, pharmacist. Yeah, pharmacist counts. Yeah, healthcare, HCP. Huh, what an interesting mix. PMHNP, okay. Maddie has, nice. What is on your glasses? Yeah, so these are dry eye glasses. Nice, nice. So yeah, we have a good mix here, it looks like. Switching to XR from Vyvanse ruined my study schedule. Thoughts on Cobenfy, etc. Yeah, so curious. Yeah, so sounds like, what's the reason that you that you follow and like come to these lives? Is it for education? Is it just to vibe, to hang out, to shoot the shit? Is it because of my totally epic and energetic personality? Yeah, I'm just curious. Also, definitely, if you like the live, or sorry, if you like this, just double tap the screen and you'll be able to like it. And if you like it, it'll help spread it to other people as well. So appreciate that. Learn something new. Okay. To figure out if I got ADHD, anxiety, depression, bipolar, etc. The list I've gotten go on. Yeah, I mean, that's definitely where you got to get an assessment done, because I won't. It's hard to really self-diagnose a lot of these things. That's why there's psychiatrists and psych providers exist to diagnose them. Is chronic dry eye from Accutane solvable? I mean, I'm neither a Accutane expert. I am neither an Accutane expert or a dry eye expert, so I can't really comment, but I've just had personal dry eye, but I'm not an expert. I've been in psychiatry for years, got my follow-up again today. I don't know what to say. Just be honest. It's not a performance, right? You're not trying to perform. So if you're, just out of curiosity, so if you're a provider, what kind of things do you struggle with? Like, especially if you're like a medical provider, like an NP or a psych provider, like a physician. Do saffron supplements help boost mood? Yeah, they can. Yeah, saffron I think is good for mild to moderate depression, anxiety. How does losing a parent at the age of 2 affect a person's adult life later on? Good question. It can affect it. If you remember it, could cause some trauma. Even if you don't remember it, there could still be some implicit genetic trauma that exists. Like you still process a lot of those things. It depends on how much love and caring that you got after that happens too. Very depressed people who don't respond to typical treatment. Okay, interesting. Best natural supplements for OCD. N-acetylcysteine is good. That's the one that I always go with for OCD. L-theanine and magnesium are just good for general anxiety. But I always like to start with N-acetylcysteine for OCD. What supplement can help with waves of anxiety? Yeah, so similar. OCD and or L-theanine and magnesium are solid. Best antipsychotic or antidepressant to treat idiopathic nausea or vomiting. I mean, they use for antipsychotics. They use I forget what the nausea one is called. Compazine is used. Oh, metchlorpromide. Yeah, so that's used for nausea. I mean, Zofran's used for nausea. So there's a couple options. Trilofan, Sulpride, yeah. How often do you see people with ADHD who had panic attacks before diagnosis and treatment? Decently. People with ADHD, because panic attacks are more associated with anxiety rather than ADHD, but ADHD can cause some anxiety. Zofran or Compazine, yeah. Is it normal for 120 milligrams of Latuda to make me throw up when I take it? That's definitely not normal. Maybe a dosage lowering is the move. How common is psychosis? I mean, not common, but common enough that a medical specialty called psychiatry exists to treat it. Is it possible to have ADHD, autism, and bipolar 2 at once? Yeah, it is possible. If you think about all those illnesses, like they're all brain illnesses. So if there's something that's struggling with the brain, then then you can definitely have multiple mental illnesses at once, just like you could have multiple heart conditions at once. Is there any way to get rid of a migraine without medication? I mean, I'm not a migraine expert, so I can't really say, I don't know. But eating healthy, sleeping, I guess limiting light exposure, like too much bright light exposure when it hits. Yeah, those would probably be a couple things, but I'm not a migraine expert by any means. I'm on a keto diet for bipolar. Yeah, I've cured some people with, or not cured, but treated people with bipolar with keto diets for sure. I think it's a very valuable diet for that. Yeah. Out of curiosity, what time is it for you? So right now for me, it's 1:30 Eastern Standard Time. So is it 1:30 for you as well, or is it later, earlier? Just curious. (1:27), 12:30 California, 10:30, 1:30 Indiana, 12:30 Chicago, 10:36. Okay, 7 p.m. in Brussels. So looks like we have a good mix here. Good diversity. Is brain fog a symptom that Is brain fog a symptom that a person with bipolar 2 is about to have low lows? Not necessarily. I mean, it could be because if you have low lows, you're entering the depressive phase. So brain fog could be associated with that, but it could also be associated with lack of sleep too. Is it true if you're scared about psychosis, you don't have it? No, that doesn't necessarily mean that's true. But psychotic people in general are not aware that they have psychosis in general, but sometimes people do. Can antipsychotics prevent psychotic episodes in BPD? They can, yeah, they can prevent them for sure. So I've used some antipsychotics with people who have some severe BPD, and it's helped them a lot. I have PTSD, how to stop being triggered like an active stalker. So I would say, I mean, you have to get the PTSD triggered. You can do exposure therapy. There's PTSD therapy. You can take medications like SSRIs to help blunt the intensity of them. So there's some different options for sure. Would you recommend dating a psychiatrist? I mean, that's a decision only you can make. Yeah, but tips would be, I don't know. I guess be honest, because they can probably detect your bullshit a little bit better than most people. But try not to, I would say, don't make them your therapist either, because I've gone into that mode where I've been in relationships and dates and stuff where people will like ask for medical advice or talk about medical stuff, and I find myself going into therapist mode or clinical mode, which is not helpful for a good, passionate relationship. How often do you think misdiagnoses happen in the field? All the time. Misdiagnoses happen all the time, and so it's quite a problem for patients and also providers too. So the problem really falls in the DSM system. It's not like, there's no objective testing, right? There's no like lab testing and stuff that can help with diagnoses. So or imaging that can help with diagnosing specifically. So it's a big problem. And so the best thing we can do is just be as accurate with our diagnostic system, the DSM-5, as much as possible. And so that's one of the reasons I created a NP coaching community in the first place, because I had a lot of NPs come up to me and they were like, hey, I'm struggling. Can you teach me? I don't feel confident with patient care. I feel like I might have the wrong diagnosis. I feel like I might have the wrong treatment. And I feel like my education was not that good. And so I had all this, a lot of people approached me and I was like, okay, I need to do something about it. And so that's when I created NP coaching program to help with that. So if you're a PMHNP, right, and you are you really want to level up your psych education, you want to stop feeling unconfident around patients, you want to stop feeling like an imposter, you don't want patients to hate you or feel like they don't trust you, right? You want employers to respect you and your knowledge, then definitely look at joining our coaching program for NPs only. Do you regret your residency choice? No, psych's the only residency I want to do that I would have ever done. I don't want to do anything else. Any advice for an incoming psych resident who's starting next week? Yeah, study up on your DSM, make sure you understand. Take notes on every patient that you see, so that way you understand the rationale, understand the diagnosis, and understand the treatment. So that way, like by the end of first year, you'll have a whole database of notes where you're like, oh yeah, I saw X patient come inpatient and they were treated with Zyprexa and Ativan, for example, for bipolar, right? So that way you start building up a depository of data of how psychiatric treatment works. What is the best medicine to heal psychosis? I mean, there's two things. I mean, antipsychotics are used to treat psychosis, but you also have to figure out if there's any kind of underlying condition too. Is it normal to be on max doses of antidepressants and antipsychotics to treat BPD and bipolar 2? It can be. It just depends. Every patient is so different, so it just depends. It's so funny. Like, if the more hate and spam you spread, right? I hope you understand that you're only promoting the live, because the more you talk, and it'll promote the live even further. So I just hope that you understand that. So thank you for your help. For how long can I take escitalopram, 20 milligrams for anxiety? I mean, I like 6 months to a year. I think that's a good benchmark, especially if you've improved, and then tapering from there. But I've had some patients who just need to take it for longer, so it depends. What is your opinion on 25 milligrams of quetiapine for insomnia versus trazodone versus orexin? I don't like quetiapine as much for insomnia, just because of the weight gain and the metabolic stuff. But unless I like it, if I'm treating something else too, like a mood disorder with it, then I think it's okay. But if it's just for sleep, then there's other stuff. Best OTC aid that doesn't cause sleep, it's cause drowsiness or grogginess in the AM. So that, I think a lot of that's dosage dependent, but the best over-the-counter ones I find are magnesium and L-theanine. Can a very dose low of Lamictal be effective for treating BD? Not really. Like, a low dose of Lamictal is probably just going to help a little bit with mood, but it won't be fully helpful for treating mood symptom, like treating full-on BD. How long a schizophrenic will see results on fish oil on 3750 milligram dosage? I mean, like, fish oil it's just a supplement. It's not like it's gonna fix schizophrenia completely. Like, to be fully functioning on schizophrenia, most people have to take antipsychotics. I am an anesthesiologist, but my therapist is 100% sure I have ADHD. Is that possible? I mean, why not? What does having anesthesiology, what does having an anesthesiology have to do with ADHD, right? It doesn't. You can totally, both things can exist. A lot of medical professionals, they can have ADHD, but they get through it with their sheer intellect, or they work way harder than everyone else to get the same result. So those are two signs that you might have ADHD, like you felt like you had to power through a lot of stuff. Why am I thinking about something untrue and want proof but can't access any proof? I'm not sure what that means. What's your opinion on PDA and autism? PDA, like, I don't know what PDA is. It's like man, my Roomba is really working today. Really working. I have ADHD, just took the MCAT, hardest thing I've had to do so far. Yeah, MCAT's pretty hard. It's gotten harder over the years. I've been thinking about going for NP, but all these people on TikTok make it seem like it's not worth it. Yeah, just remember that TikTok is an echo chamber, and it will feed hateful content. Often rises because people share hateful content, negative content, more than positive content. This is why negative news is always better than positive news, because like for the news companies, because people don't share negative news, but people react and share or people don't share positive news, they share negative news. So TikTok, you're more likely to see anti-NP content and negative content rather than seeing positive content. Chelsea says, I have an endoscopy on Friday. Is it safe to take my clonazepam? Yeah, an endoscopy won't affect your clonazepam at all. Clonazepam will get absorbed pretty quickly. An endoscopy is just a physical procedure, so it shouldn't affect that at all. Pathologic demand avoidance. I'm still not sure what that means. But yeah, I assume that means that they don't want to follow instructions, which can happen with autism, yes. Do you hate people? Yes, obviously. H. Singh says, I know that Roomba sound all too well. What up? Hey, what's up? Yeah, exactly. So many NPs out there and such diverse yeah, there's so many diverse opportunities. I went to a couple conferences over the last few weeks, and the amount of opportunities I saw were crazy. So this is what I tell my NP students as well. They asked me about like, okay, how was the conference? And what I said was that, before I go to these kind of conferences, what I think is that, okay, there's outpatient, there's inpatient opportunities, there might be like ER opportunities, and mainly I get exposed to only clinical roles. But then when I went to this conference, I realized, oh wow, like there's people who are medical sales liaison, and they're NPs, PharmDs, PhDs, and they educate people on various medications. So like that's literally a job, and they'll travel across the country or the states just educating people and getting lunches and dinners and all that. And like that was literally a job. There's other people who run conferences, NPs and stuff. So like that's a job too. There's people who have interesting startups. Like I ran into there's a lot of genetic startups, AI startups that are coming out. So that's coming out. That's a thing too. One of my friends, he's a psychiatrist, and he's part of a startup that's doing functional medicine and AI work together, basically gathering AI data on functional medicine patients. So they're looking at hiring some NPs as part of their company, and paying them like $200K plus. So basically, there's a lot of opportunities out there, especially for NPs, but you only realize a lot of them if you have a good network. Like you're not going to find the best stuff on the internet. You find it through networking and connections. And so that's where being part of a network or a community is super helpful if you are an NP who is looking for a new role or to like level up their role, because you only find out about the best shit through networking. And so, for example, now in my program, I had the Genomind company come and give a talk in my program yesterday to educate my members on it. I'm going to have some medical companies as well give talks, so that way we can get educated. Like we have one coming up for not Cobenfy, but what's the other one? It's not Vraylar, it's Caplyta. So I have a Caplyta talk coming up in a few weeks, and like I was able to get that because I networked at the conference. But basically the point is that you have to find a community if you really want to network. That's my food. If you want to level up your career and find a better job, networking is the best way. And so one of the best ways to do that is through joining a community or a program to network with other people. And so if that interests you, then definitely look at joining our NP community as well. You can see that in my bio. Or to send me a message. But all right, so that's an interesting question. Why do you care so much about NPs when they're looked at lesser as than physicians? Well, that's exactly it, right? They're looked at as lesser than physicians. Like there's a lot of hate that people get. And now my audience is a lot of NPs, so I have to serve my audience. And we're all colleagues. Like Pandora's box has already been opened. So while a lot of physicians and docs talk shit about NPs, I'm like, well, we're all going to be working together for patient care. So rather than gatekeeping the psychiatric knowledge that I have, it's better disseminated to people so that way I can help, rather than just like keeping it to myself and be like, no, NPs are shit, and like just like I was told that I'm a disgrace to medicine, but you know, fuck them. Like that's their opinion. But anyway, food is ready. So it is time to eat. So I think what I'm going to do is just take out stuff one at a time, slowly rather than all quickly. So I'm going to take out like 1 or 2 pieces of chicken, plus 1 or 2 pieces of fish, and then broccoli at the end, rather than taking them all out together. Ooh, fuck. I just kicked the oven door. Actually, let me put some salt and pepper on the broccoli as well. What's the easiest way to find an in-network, in-person psychiatrist? Well, it's hard to do that because the best psychiatrists are all out of network, because we know that you can't give the best care in network, because in network, what's going to happen is that they're going to really limit the psychiatrist to like 15-minute med checks and stuff. So that's why all the best providers, or at least the best psychiatrists that I know, they're all outpatient or out of network. So I would definitely recommend, if you want the best of the best, out of network is the way to go. Right? That's how it's always been, right? That's why people go to private schools instead of public schools. It's for that reason. But for example, something I do is that I will file reimbursements for out-of-network benefits for all my patients. So if you're interested in working with me, you can schedule a consult call either in my bio or just send me a message there. How common can I donate blood even though I'm taking sertraline and quetiapine? Yeah, that's fine. Those things aren't. They'll tell you if it's a problem to take X or Y medication at the blood center, but sertraline is not usually a contraindication. Do you take shadows? No, I only work remotely, so yeah, not taking any shadows. But you should be able to. If you're a med student, you should find some academic psychiatrist in your own institution. Came out okay. Probably need to let the chicken thaw out for longer before, yeah, I probably need to let it thaw out for longer. What did you cook? So I cooked chicken and salmon and some broccoli. Jennifer, you should not be, please don't type in all caps. It's, that comes across in online culture as you're screaming. How common is CPTSD in late diagnosed autism and ADHD? I mean, those are separate. PTSD is not the same as autism, but I don't think it's that common. You know, PTSD could happen to anyone. I take Invega and makes me gain weight. Yes, eat like this. Don't give in to snack cravings. When you eat mostly protein and veggies, you'll be so full that you can't eat junk food. So cut out all the junk food from your home, and that will prevent weight gain. That's what I did. Like, I have a big dessert fetish, dessert cravings, and so I said, okay, I'm not buying any more dessert. I'm just having protein bars and Greek yogurt and berries, and like that's my dessert now. And so that's helped me a lot with weight loss and just maintaining a good physique, is because like I've eliminated temptation from my home. I got diagnosed with CPTSD 6 years ago, but I feel like it's not a right fit. What to do? Then you want to get a second opinion. If you don't feel like you agree with your diagnosis, you want to get a second opinion. And so I see a lot of patients for that. Actually, a lot of patients come to me for second opinions. So if you want to get a second opinion, you can book a consult with me either in my bio or just send me a message. I can send you the link. I cut down from 40,000 calories to 35,000 a day, still no change. Well, yeah, so you see, there's multiple things wrong with that. One is that I assume you mean 4,000, not 40,000, because 40,000 would be like enough calories for like 3 weeks. So 4,000 though is still a shit ton of calories. You need to do what's called a BMR calculator, where you put in your height and weight and age, and you find out how much calories you burn per day. And no one's burning 4,000 calories per day unless you're like a football player who's training in the NFL. Like, most people burn around 2,000, 2,500-ish. Like, for me, I burn around 1,700. So you're probably burning around 2,000 or whatever. So that's why you're not losing weight, because you're still eating way more people. Still eating way more. What's wrong with my question? Nothing is wrong with your question. I'm currently on Strattera and IR methylphenidate, okay. Hi, best way to help a hoarder? Yeah, probably an intervention. I had a patient who had an intervention, and the family literally came together and they had to throw out a lot of her stuff, as well as getting OCD treatment. What city? Guess. Can you guess the city? Any advice how to match into psych? Yeah, make sure that psych is your first choice and all your application is geared towards psych. Psych doesn't like dual applicants because you're not committed to the specialty. Just express good, strong commitment to the specialty. You seem like a great doctor, calm and collected. It's the salmon. Do you have interests outside of medicine? Do you hours a lot for that? Yes. So all of my interest is primarily in social media. I'm not the typical, if you're trying to look for typical psychiatry stuff, I'm not the person to follow. Like, you don't want to follow me if you want like a typical psych type of career. But if you want more of the influencer type of lifestyle psych career, then that's something to follow me for, because that's my interest. I want to help other healthcare providers be able to break out of their jobs and be able to live the online or like influencer lifestyle. Like, that's a future goal of mine, because I think that jobs really handicap a lot of people, and a lot of jobs are very toxic, and a lot of jobs, they will not pay you what you're worth. But I'm a black sheep, so, you know. It's also really nice working for yourself, because then no one can tell you what to do. Like, if you're a healthcare provider, like you're in medicine or you're in NP school, like you probably get told, hey, do this, do that, study this, show up to this meeting. If you're working, you're told, okay, go see this patient, now see this patient. Basically, you just have to crank out patients, and you just get tired of it. You're like, I'm sick and tired of this. That's why you have burnout. Because like some of my NP students tell me that they were seeing 20 to 25 patients, 30 patients per day, because their employers are just like, hey, we got to get you pumping out patients. New York. I live in New York. Yeah. I've been to Chicago. It's nice, but I live in New York. Therapist here at a behavioral hospital, watching you live during my lunch break. That's funny. Nice, nice. Yeah, but hospitals stress me out personally. That's why I had to live online. Work online, sorry. And work remotely. And work outpatient. But that's me. I know other people get very excited by the hospital lifestyle, but just not for me. Yes, I mean, I agree. I think private practice is the way to go for sure, no matter what specialty you're in, if you want the best quality of life. But there's different, people are different. Like some people, they like the hospital environment. They like that type of work. And we need people to do it because then the emergency rooms won't get stocked. The inpatient hospitals won't get stocked. So that's why I think what's more important is really understanding who you are and what really appeals to you. Like I'm someone, I don't like being out all the time. I do not like traveling a whole bunch. I don't like interacting with people all day. Like I like just kind of being in my house, in my apartment. So this type of lifestyle works very well for me, but other people would hate it. When would you recommend bupropion over escitalopram if I'm trying to treat low energy depression and ADHD rather than depression and anxiety? Anything to complement Cymbalta works for pain and anxiety, not for depression. 60 milligrams. Yeah, I've had patients go up from 60, like they've taken 190 or 120, and that's helped them. How to communicate to my doctor that Ativan is not helping, I need something stronger. Literally, you say that, and you say the reasoning for it and what life experience you've had. Is it the end of the world if students don't match into going to residency? No, you try again next year. My cousin didn't match into psych this year, and he's trying again this year, or like next year. Or you explore alternate careers, like becoming a medical science liaison with like a pharmaceutical company, for example, starting your own business or a startup, becoming a healthcare influencer. Like there's a lot of options. Did he take it well? I assume you're talking about residency matching. I mean, like, yeah, you take it as well as you can. I mean, you're in control of your reactions. Remember that. Obviously, he wasn't happy. No one's going to be happy about it, but yeah. Yeah, but they don't want to give me anything stronger than Ativan. Well, then you have a good conversation with them, and if you feel like the provider's not meeting your needs, you get a second opinion and you work with someone else. Like, that's how it goes, right? It's like saying, hey, I'm in a relationship, but my partner isn't giving me what what I'm looking for. What do I do? Well, it's like either you stick with it and suffer, or you find a new partner who meets your needs, right? Or either you work it out or you move on. Like, there's no other option. So it's the same thing with your provider. Challenges working being a psychiatric provider versus other specialties. Yeah, you have to really monitor your interpersonal reactions. Like, if your surgeon is a dick, it's like whatever, like it's almost expected. But if your psychiatrist is not the most empathetic, understanding kind of person, then people take it a lot more personally than they would if it's a surgeon, for example. And then you also have to be really able to hear a lot of people's emotional struggles and not let it affect yourself. Sertraline gives me blunting. Sometimes it can do that, yeah. Depends on the dose. Do you eat salmon every day? I personally do. Every day I'm at home. Because it's got good omega-3s, good fats, good protein. My brain feels sharp when I have a mainly protein and veggies diet. Thoughts on Prozac versus Zoloft for general anxiety? Both are decent. Both, I think Zoloft is a little bit better for anxiety purposes, but both work. Prozac I think is better for like energizing. My doctor cut my dosage with lorazepam after taking it for 24 years. Okay, I mean that's a long time to take lorazepam. Thoughts on Prozac? Oh yeah, I answered that one. Best anxiety meds for someone feeling just considering starting. I mean, if you're just considering starting, an SSRI is usually a good starting bet, and then you go from there. Does Seroquel cause diabetes? It can contribute to it. BPD during pregnancy advice, do you mean bipolar disorder or borderline personality? Because those are different. I assume you mean borderline personality, but just confirming. Why do I yawn constantly on SSRIs? It can make people sleepy. Borderline, yeah. So in pregnancy, your hormones are going to be a lot more volatile, and combined with borderline, you might be really emotionally distressed, more volatile, getting irritated easily, etc. So I would say start practicing mindfulness very strongly and become aware that, okay, I'm feeling angry or upset right now because my hormones or my emotions are going out of control. And then work on improving your distress tolerance from that. Does Ativan interfere with SSRIs? Not really. It's usually used as more of a a thing to help for the first month or so as the SSRI gets to a good dose. I was taking Ambien sleep because nothing else works for my insomnia. I was taking Ambien sleep because nothing else works for my insomnia with my bipolar disorder and PTSD. I mean, yeah, sometimes you gotta do what you gotta do. PTSD can make it hard to fall asleep. I told my doctor I've been procrastinating because of sertraline. She told me it's a me issue. I mean, yeah, like you don't want to be blaming things for... Sertraline isn't causing procrastination, right? Procrastination is that's based off of a choice that you're making. When you got in the moment, you choose to work on something else instead of working on the thing that you need to. Could be an ADHD issue, but assigning the blame to other things is not going to help you solve the problem. Always remember that. How do I get my GP to change me off sertraline? I mean, that's where you might need a psychiatrist. GPs shouldn't be treating your mental health beyond like 1 or 2 meds max, because that's not their expertise, and like they know that. So that's why I would consider working with a psychiatrist. And so I see a lot of referrals from GPs as well too, or people who've tried like 1 or 2 things from their GP and they're like, okay, I need to try something else. So, if you want to work with a psychiatrist, specifically you want to work with me, right? You like my education, you feel like I can help you. Best way to do that is to book a consult either in my bio or just send me a message. And yeah, you can do that. Also, if this is helpful to you, just like the video, just double tap it and it will like it. And that way we can spread it to more people. Is Prozac or Zoloft better when it comes to not causing weight gain? Prozac is better than Zoloft for avoiding weight gain. Why does my doc assume I have anxiety because I got bullied? I mean, I don't know. I'm not that person, so I can't say. But if you got bullied, that can cause people anxiety. So if you don't feel like contributed, you have to say that. Remember that patients have to advocate for themselves too. Like doctors and providers don't know everything, and so it's not like it's a two-way street. It's a two-way communication. So if there's some kind of issue that's happening, that should be discussed with them. Thank you for the likes. Appreciate it. Does Celexa cause gastro issues and stomach growling? It can. Celexa can cause some stomach issues. I've seen that before. Are you a Psych NP? No, I'm a psychiatrist. But I coach Psych NPs. I have a coaching program in community where I teach Psych NPs about psychiatric diagnoses, treatments, etc. Because I had a lot of NPs approach me and ask for help, saying they didn't feel confident in treating patients, in diagnostic skills and psychiatry skills. They felt like their preceptors didn't teach them enough. And so I was like, okay, well, I got to do something about this. And rather than just keeping knowledge gatekept in my head, I was like, okay, I need to tell people. And then, yeah, that's how that was born. Oops. Why are so many psychs out of network? Because in network will mess up the care that a lot of people get. Basically, network will force you to do like 15-minute visits and just med checks. I can't talk about therapy and lifestyle changes and nutrition and all that stuff if I go in network because the visits are too short. So that's why you have to go out of network to get the best care. Got diagnosed before my residency in OB-GYN. What advice can you give me? I mean, it's going to be hard because in OB-GYN residency, you're probably not going to get that much sleep. So I would say what you need to do if you have bipolar and you're in OB-GYN residency is you need to take care of your stress levels as much as possible. So that means avoiding toxic people, making sure you get as much sleep as you can given your residency, eating very healthy and very clean because that will help your stress level, and especially eating a ketogenic or low carb diet because that'll help your bipolar stabilize more than eating a high carb diet. The worst thing that you could do is hang around toxic people, not sleep, eat shitty food, and be stressed all the time. That's going to make your bipolar way worse, and you'll probably have depressive or manic episodes. Easier said than done, but always remember that. Have you been on any psych meds yourself? I have not, personally. Any tips on how to manage anxiety with perimenopause? Yeah, you can do an SSRI, you can do some supplements. There's some hormonal therapies that can be helpful seeing an OB-GYN, like maybe if it's a severe hormonal issue. Meditation, sleeping well. I mean, the basics are always the basics. Like, part of the reason that I go live when I'm eating is because you see, like, this is literally what I eat. Like, I don't just tell people, oh, eat salmon and stuff and not do it. Like, this is what I eat on a day-to-day basis. And, like, it really helps me keep my brain and my mind sharp. And that's super, super important for me to do that. And I feel like it helps me a lot with mental health, too. So, for example, last night I slept 8 hours. I worked out this morning, went to the gym, and now I'm eating protein and veggies. I'm just gonna eat it. Dude, this is so much protein, it's crazy. You know, but gotta do what you gotta do for the gains. Will you have a full dinner? No, so I eat once a day. So this is my dinner, lunch, whatever. Yeah, for me, I like to get all my calories in one meal, but that's just, it's kind of like, okay, I just want to get my eating done and over with, and then move on with my life. And plus, I just like the feeling of eating a big meal, but that's just me. Like, I understand that it's not a normal thing for the average person. And because I really like intermittent fasting and I believe in it. Oops, I don't need that anymore. How do you hydrate yourself? I mean, I just drink a lot of water. I like water, I like sparkling water, so that's how I hydrate. I wonder if it helped or did not help. How many pieces? So I made 2 pieces of salmon and 3 pieces of chicken. Yeah, so I definitely like my protein, yeah. Do you do shakes? I don't do shakes. I used to, but since I eat once a day, I want my food to be filling, and shakes are not nearly as filling as proteins, like just meat. Like, I'm no chef. Like, I'm not a chef. Like, I just like eating, I just eat protein for my health and how I feel. And, but I'm not a chef. Like, I'm not trying to make delicious, succulent dishes for other people. Do you treat neurodivergent? Yeah, of course. ADHD, autism. I'm a child psychiatrist, so I see a lot of autistic people and neurodivergent people. I mean, I treat both, right? Because I did my residency with adult psychiatry first, and then did a child and adolescent fellowship. So I do both. What seasonings do you use? I mean, this is just salt and pepper. And then I use some parsley flakes and some garlic. That's it. Oh, I have lime juice too. I forgot about that. I'm gonna try that. Someone told me that I should put lime juice on. Ow. Yeah, someone told me that I should put lime juice on my salmon. I don't have lemon juice. I'm gonna try this and see how well it comes out. It could be complete ass or it could be good too. We'll see. Why do you go live when you eat? Just so you can see that I'm not bullshitting. Like, this is what I actually eat on a day-to-day basis. I'm not just like saying, oh yeah, eat healthy and then eating crap all the time. Like, this is legitimately what I eat. Do you eat any carbs that are healthy, like brown rice or baked potatoes or sweet potatoes? No, not really. I mean, like, if I go out, I will. But if I'm at home, no, because and for me, it's just a waste of calories. I find that I do the best when I keep my diet low carb. Like, that's when my brain is the sharpest. Because carbs will spike up your blood sugar and then spike it down. And even if you have healthy carbs, they'll still increase your blood sugar and decrease it just slower. It will be, it's not a fresh lime. Yeah, I don't have a fresh lime. And plus, it's just a convenient time. Carbs are my weakness. Yes, carbs are most people's weaknesses. That's why, right? No one ever says that, okay, you know that if something tastes good, like, you know that it's bad for you. Like, that's why vegetables are good for you, but they don't taste as good. Protein, people don't crave, like, protein that much. Like, no one goes, oh yeah, I'm craving, like, chicken and rice. Right? That's why they crave carbs. That's why they crave desserts. That's why they crave nicotine. That's why they crave other things, because those are the things that are bad for you. So yeah, That's why, like, simple carbs are like cereals and sugars, and those are the things that people crave. What are you eating? Yeah, so chicken and salmon, and then I have a bunch of broccoli coming up. But this will be my whole food for the day. Also, like, I just came back from a 10-day Iceland trip where I definitely had a lot of snacks, a lot of nuts, a lot of trail mix, a lot of Icelandic chocolate. So now I'm trying to cleanse my body by eating clean now. Is broccoli a carb? Yeah, broccoli's a carb. As the saddest looking piece of chicken and salmon. Well, of course, that's why I'm not serving it to you. It's all gonna go down in my belly and get disrupted by the stomach acid, hydrochloric acid, so it doesn't really matter how it looks. I'm eating Popeyes. Oh, see? Decisions. Remember, the actions you take every action you take will have a consequence, whether it's good or bad. So by controlling the inputs, the actions you take, that's how you control the consequences that happen. How do you feel about Auvelity? It's a good medication for low energy depression. Shall I do psychiatry? If I need to convince you to do psychiatry, then psychiatry is not the field for you. Every dermatologist I know, they don't need convincing to do derm. Every orthopedist doesn't need convincing to become an orthopedic surgeon. So similarly for psych, I think that field should have that respect that it deserves. Thoughts on ashwagandha short term? Disagree. I think it's better long term. It takes like a couple months to start noticing benefits. Oh, that's the parsley. I decided on day trading over Psych NP. Nice. Yeah, it's always better to, work for yourself, in my opinion. Have you heard of visual snow? I don't know what that means, or PPD. I don't know what PPPD is. My doctor lowered my dosage of lorazepam from 2 milligrams to 1 milligram. Should I get a low doctor? I mean, I don't know their situation, so I can't really comment, right? That's a decision only you can make. Good evening. Does acetalopram cause weight gain by itself, or does it change your hunger? Both. So it can reduce your metabolism a little bit as well as increase hunger. That's why I always say eat foods like this, so that way you're full, so you're not going to be eating junk food. That's how you can curb your intake. A weight gain on psych meds. Best thing for anxiety. So many things: meds, therapy, exercise, exposure. Maryland? No, I don't live in Maryland. I'm a licensed mental health counselor and wish I went to school for psychiatry. Well, it's never too late, of course, but it definitely will be an uphill struggle. I love salmon. Yes, I do too. Eat it every day. So that's a little bone. It's a little bone in there. Is it farm raised? Wild caught. What are important informations a patient should disclose during the first psych appointment? Be honest. Disclose your substances that you use. Don't you feel hungry at bed? No. Human beings are used to fasting, so it's pretty normal for us. If you think about our ancestors, they would hunt, they would feast on what they got, and then they wouldn't eat again until they were able to hunt again. So we're all used to fasting. And hunger, I find, is very habitual. When I was eating intermittent fasting twice a day, I would get hungry around 12 p.m. and 6 p.m. When I was eating normal meals, like I would get hungry at like 9 a.m., 1 p.m., and 6 p.m. And then when I eat once a day, I only get hungry during this time. So I find that hunger is just a habit. Do you add salt and pepper? Yeah. Sea salt and pepper. I have an old relative back home and he has schizophrenia, but he doesn't hallucinate. Yeah, you don't have to necessarily hallucinate with schizophrenia. You can have delusions with it. You can have your reality testing may not be intact. Like, you know, you might get confused between reality and non-reality. You don't necessarily have to be delusional, or you don't have to be hallucinating. What benefits have you noticed fasting? Easy to maintain weight. It feels good eating big meals. Able to not get fat, basically, for myself. And mental clarity is very sharp too, especially in the morning. Being hangry is yeah, exactly. I agree. Damn, I'm pretty full now. Yeah, I have some carbs for sure. Like I'll eat fries and stuff like when I go out, or rice. But at home, mainly just chocolate and Greek yogurt and broccoli. How many calories per day? Usually around 1,500. The way I approach it is that, you know, on the weekends I might have a little bit more because I'm going out and stuff. So during the weekdays I have less and it balances out. What is your eating window? Usually around like 1 to 3 p.m. Can you explain reality? Yeah, I know this. I need to finish this salmon. Can you explain reality testing? Yeah, that's basically awareness of the real world and what's real and what's not. So people with schizophrenia, even though they might not hallucinate, they might get confused what's real and what's not real. My eating habits are not for everyone. They're just what I do. What do you think about somatic therapy interventions? Yeah, it makes sense, especially for PTSD. A lot of people have like physical reactions, so being able to calm down those physical reactions can be very helpful. Do you consume alcohol on the weekends? Sometimes if I go out. But if I don't go out, then I don't touch it. Who gets to define what is real and what's not real? Okay. That's usually what the majority will define. There's no questions that you can ask for reality testing. It's not like, you know, but you can ask them, okay, like, where are we? Who's the president? Like orientation questions, like, you know, just get a sense of what they know is going on. Like patients won't even know how they ended up in the hospital or why they're in the hospital. So that can be a side of poor insight. Is saffron really good for depression? I won't say it's really good, but it's an option. It can be helpful for mild depression. Do you think hummus is a good option? I think hummus is just made out of chickpeas, which is a lot of carbs, and it's not that well processed. It can be processed, but it's definitely a healthier option for sure. My husband's father is schizophrenic. I'm worried if my future kids might inherit it. Yeah, schizophrenia is a heritable illness. That is correct. So it can inherit it. You know, it's a legitimate concern. Also, if you like this chat, definitely double tap it, and that way you can like it, and we can share it to more people. So definitely like it if you feel like this has been helpful. Is there a good way to deal with health anxiety? I've never met someone whose eating habits align with mine. That's so funny. Yeah, my eating habits are not the same as the majority of people. So uh, take it for what it's worth. I have to adjust to like social situations and things. You know, like for example, I just went on a 10-day trip to Iceland with my family, and they're having breakfast and they're having like stopping for snacks and stopping for lunch and getting dinner. I was like, oh my god, like just get your eating done and move on with your day. But that's my opinion. Does anxiety manifest into real symptoms? It can, yes, definitely. Definitely, definitely, definitely. You can't inherit anything against your will. Inherited will. If you know where the concept of inherited, if you know where inherited will is a big deal, then please mention it, and I will love you forever. Oh yeah, Reykjavik water, Iceland water, nothing beats that. Best water I've had in my life. So clear, so pure. Best air I've ever had too in my life. Did you go to Turkey? I went to India actually, but thank you, I appreciate that. Does Vibrate work for OCD? Yeah, it can. It doesn't have enough data on it for OCD. Mainly the data is for the anxiety and depression just because it's newer. But theoretically, if the other SSRIs can work, then Vibrate should be able to work too with its serotonergic mechanism. Does Vraylar cause weight gain? It's one of the lesser likely ones. I feel like you're very intrinsically disciplined. What advice has clicked for clients there? Basically, I view that life is a video game, and that instead of trying to level up in a video game, we should be trying to level up in real life. And it makes life very fun for me because every day I'm thinking, okay, what can I level up? What skill can I get better in? What can I improve? So just like in a game where you're grinding to level up your character or to beat bosses, I'm leveling myself up, whether I'm working on my business or my fitness or, social media, my social life, whatever I'm working on, like I view it as I'm leveling up, and it makes living life very fun, and it makes the discipline come easy because I'm focused on leveling up. Just like in a game, you know that if you want to beat X or Y boss, like in Pokemon, for example, if you want to challenge the Pokemon League and their levels are higher than yours, then you need to level up your Pokemon to match the Pokemon League's levels. Like it's pretty simple. So that's how I view real life, and that's really helped make it enjoyable. How do you feel about the Bronx? Yeah, I would have lived there. In my residency, I applied to Montefiore Albert Einstein for my residency, and if I had matched there, I would have lived in the Bronx. Can you 360 no scope? I cannot. I was always more of a hard scoper. I liked lining up and getting headshots. What do you recommend for OCD? High dose SSRIs, exposure therapy, and acetylcysteine. Wait a minute, is this pre-recorded? My lives will get recorded on Instagram or on YouTube. So you can just go to my YouTube channel and then you can see it be all recorded there. How do you get past food noise when you have already had your one meal? I'm not sure what that means, food noise. Social skills, I want to level up. I've been isolated for years. Well, yeah, that's like saying, hey, I want to level up my Pokemon, but they've been chilling in my box for years. It's like, yeah, they're not going to level up chilling in the box with Professor Oak. Like, you got to get them out. You got to get them out in the field battling some wild Pokemon. So it's the same thing with social anxiety. You got to get out in the wild. You got to walk into the grass. Yeah, you gotta touch grass. Ooh, piece of salmon. It's been like an hour. How are you on the same plate? And actually, that was my second plate. And also, I'm chatting with you. That's why. So that's why I do my one meal a day, but I take it slow and I enjoy it. You know, I don't just like rush to eat and then move on. But this is my one meal. If you could change your field, what was your second pick? Probably neurology or family med. Maybe radiology too. I really like working from home. But if I didn't do medicine, I would have become a YouTuber. Like if I like started over from college, I would have become a YouTuber. When is your birthday? Next Monday. I am curious about the questions asked if ADHD can be treated without stimulants. Yeah, it can. Eat a high protein diet. Sleep 8 to 9 hours. Work on your habits like habit stacking and scheduling, calendaring. Work on your discipline skill. So it can definitely be, you can definitely address it without it. My psychiatrist told me to take 300 milligrams for OCD. Sertraline, yeah, sometimes OCD needs a higher dose than standard SSRI doses, so 300 makes sense. Views on conspiracy theories, I believe them. I don't believe that I believe most conspiracy theories are facts, but that's my opinion. Every time I see that you're eating, yeah, it's because maybe every time I go live, I'm eating. Like, that's like going up to your professor and be like, hey, every time I see you, you're teaching. Like, yeah, because you see me during class. Is GeneSight testing worth it? I prefer GenoMind over GeneSight, but I do think it is a valuable addition to people. So that's something that I also offer too in my practice is genetic testing. So if that interests you, you want to get genetic testing so that way you have more of an idea of what med's going to work and how well it will work. The best way to do that is you can schedule a consult, either send me a message or check my bio. Do you enjoy working with acutely intoxicated patients? No, not really. That's more of an emergency room thing, and I am definitely not an emergency room psychiatrist. Happy early birthday, thank you. I gotta get out in the wild, sounds fun, yeah. Any recommendations for me as a partner of someone in the beginning of a mental health journey with depression, PTSD, and anxiety and anger issues? Yeah, be supportive of them and use motivational interviewing to help guide their motivation, help them stay motivated to complete treatment, because a lot of people will give up basically. Your food looks healthy, thank you. What psych disorders do you have or relate to? I don't have any psych disorders, but I definitely had confidence and social anxiety issues when I was younger. Is brain mapping helpful? I mean, I've never personally used it. Yeah, if you want to know more about my sessions, best way to know that is on my bio. That's where you can look at more in my sessions and see if we're a good fit to work together. May I ask what state you're in? I'm in New York. I live in New York, yeah. You're always eating when I get on here. Maybe it's because you always get on here when I'm eating. My goodness, that's a lot of broccoli. Man is always eating. Yep, one meal a day. This is literally, I had 3 different meals. Yeah, I enjoy broccoli. Do you eat fruit regularly? No, I'm not a fruit person. Fruit is sugar. I eat more veggies. Do you think radiology will be impacted by AI? I mean, I'm not a radiologist, so I don't really know. Sure, it will, but I think that people are just getting too scared of AI. It's like getting scared of Google and stuff. You'll just adapt. So AI will become a tool that radiologists can use. So like AI could do some of the simple reads, and then the psychiatrist or the radiologist does the complex ones. Or if it does even more of the complex reads, then the radiologist will monitor them. So yeah, it's just you use it to your advantage, right? Either you see with any kind of life change that happens, either you complain about it, or you level up. Like those are your only two options. How do you cook your broccoli? I cook it in the oven. Are you Palestinian? No, I am Indian. I'm not Palestinian. Hi, what med school do you attend? South Alabama. Do you believe in the gut-brain connection? Absolutely. I think it's super, super important. That's why, like, for me, like, I eat healthy. Like, I just ate protein and not veggies because keeping my gut healthy is super important because that's what keeps my brain sharp. The gut makes 80 to 90% of the brain's serotonin and dopamine. Thank you for sharing the live. Yeah, if you like this live, definitely click double tap it so that way it can get liked, and that way more people are able to get exposed to this. Are you really getting 30 grams of fiber? Bro, this is way more than 30 grams of fiber. How safe for SSRIs in adolescents? Yeah, there's some good data for SSRIs in adolescents. I don't want to keep an adolescent on them for the rest of their life, but if they're going through a tough transition period, I think it can be worth it, especially if it can help lessen their distress in school, at home, and help them until their brain matures more. Thank you for sharing the live. Because remember that untreated mental illness causes inflammation and causes cortisol. And cortisol is a stress hormone, and the stress hormone, cortisol, is very damaging to cells if it persists. So that's why it's good to make sure that mental illness is treated too. Why don't you eat the broccoli and salmon together? I left the broccoli in the oven so it could stay warm. If I brought it out, it would have gotten cold. If you have a mental illness, depression, anxiety, bipolar, whatever, and you don't have it treated, that causes more stress to you, ADHD. And if you have more stress, that causes cortisol release. And cortisol is damaging to our bodies. It literally will damage your body if it persists for too long. So it's important to make sure that mental conditions are treated. That way you're not damaging your body from stress. Are you a vegan? No, I'm not a vegan, no. Is protein goal actually important? Is fiber more important? They're separate. Protein is separate than fiber. That's like saying, are bicep extensions important? Or like bicep curls more important? Or like tricep extensions? Like they're both important. They work out different things. I have PTSD, slight depression, and OCD. Is effects are good for this? Yeah, effects is actually good for all of those. Depression is separate than grief. Are you saying that you should treat depression such as losing a loved one or recover naturally? That losing a loved one is grief, not depression. Depression is when grief goes too haywire and it affects your day-to-day functioning and your day-to-day mood and happiness for an extended period of time. Why do I keep touching wood when I get upsetting thoughts in my head? Because the wood is grounding. I mean, that could be an OCD thing as well. You know, because that could be a compulsion for OCD, but wood is ground, like I can touch it, you know, it's grounding. It feels nice. Nice dinner. Yeah, this is lunch / dinner. 1 meal a day. Because like I eat the same shit every day, and you come back every day here, like you got proof. I should have stocks in. If broccoli could have stocks, like I would be the stock owner for that. I would be the majority shareholder. How to know if effects or dosage is too high? If you're having side effects, that's the best way to tell. Broccoli is a carb, not a vegetable. Both. Broccoli is a carb and a vegetable. Is your broccoli cold? It's not warm, but it's not cold. I am an SMI case manager. Nice, nice. Okay, I think I'm full. I had a little too much salmon and chicken earlier, so I think I'm full. Nalufa says, just wanted to say appreciate you for making mental health informative videos. Thank you, I hope it's been helpful. Is mental health a discussion, a sexual health discussion you have with patients? Depends on the patient. I think I might just call it. Yeah. I'm debating, do I just finish this rest of this plate of broccoli or do I save it for later? I've already had 2 pieces of salmon and 3 pieces of chicken. So like that was all very, very filling. I think I might save it. I usually will eat everything, but I'm feeling very, very full. How do you manage appetite suppression side effect without DCing the med? Eating before. Scheduling regular meals. Eating higher calorie stuff like shakes. I love broccoli, yeah, I do too. How many grams of protein? I mean, that's easily like 140 grams of protein. 3 pieces of chicken, probably like 20 grams each. Plus 2 pieces of salmon, so probably 140, yeah. Why do I have really bad anhedonia with Latuda? I mean, you have to question, is it the Latuda or is it the underlying condition? Yeah, I think I'm gonna pack up this broccoli. I feel pretty full. I will look into this. I'm in Arizona. Are probiotics worth it? They can be if you have a lot of gut health issues or anxiety issues. I always ask my patients, like, do you have any gut problems? Like, not eating enough or like gut health problems like constipation or diarrhea. If they have those problems, then and they have anxiety, then I'll recommend them probiotics and fiber. But if they don't, then it may not be worth it. Like for me, like, you know, you've seen how much broccoli I eat, so I don't have any fiber problems. And my gut's pretty good. What do you think about using Zofran, Wet Trintellix? Yeah, you can use it, that's fine. Not a big issue. Why do you eat so much protein? I just feel healthier eating lots of protein. I mean, lifting and plus low carbs. It keeps my brain sharp because then you don't have blood sugar up and downs. Yeah, I think this is, I've had my broccoli for the day. So that the rest I shall save for tomorrow. Now we just need to find a container to put it in. How do you cook your broccoli? In the oven. What do you think of flax seeds? I eat flax seeds sometimes. I've heard that they're estrogenic though, so I don't make them a core part of my diet. I eat mainly pumpkin seeds. Do you recommend kefir? I don't know anything about kefir. I use Greek yogurt personally, but I think kefir is like a probiotic thing, right? I've just never tried it. Do you drink coffee? Occasionally if I want a good pre-workout or I haven't had a good night of sleep, but I try to avoid it because it affects my sleep, unfortunately. It makes it harder to sleep. You are on your period. Who, me or someone else? Do you have closers to help sell your program? No, I don't need closers. It's not a high-ticket program. So, if someone's interested in it, then they will sign up, right? It's just a monthly subscription. So you can just sign up for a month, and if you don't like it, then you leave. But very, very few people leave. Everyone who signs up for the program stays because the value that they get is quite a bit. Like imagine, right, if you're an NP and you feel like you're not getting education, now you have a psychiatrist who's literally teaching you the stuff that I learned in residency and fellowship and helping you with your real life cases. So you're not going to get that in the real world a lot of times. So people really see the value for the program. And so if that interests you, then definitely look at joining too. Like if you're tired of patients not respecting you, if you're tired of other colleagues not respecting you, if you want to, like if you don't want to lose respect among patients, or you don't want to keep feeling that people are not respecting you for your degree and all the work you've done just because you're an NP, then I would definitely look at joining. That's a big reason that a lot of NPs join, is they feel like other providers don't respect them. They immediately judge them as well, just for being an NP. We have ChatGPT. Okay, next time you get in a medical emergency, instead of going to the ER, go to ChatGPT and we'll see how you do. ChatGPT it's a tool. It's not a replacement for medical care. And don't get me wrong, I love ChatGPT. I use it all the time. But it's a tool. That's all it is. Why do you need to go garbage? The kid things people say are so ridiculous. Yeah, it's fine though. Yeah, I definitely need to watch it. See, what people don't understand is that when they say ridiculous things, it literally just like promotes the live even more. So it's a win-win for me. Like I don't really complain. Why do all dishwashers sound like that when opening? Yeah, I don't know. Maybe it's like a dishwasher conspiracy. Four was the magic number. Okay, so this I'm just actually I'll just wash it. That sounds painful. Felt like a zombie. What are we looking at? What's your opinion for ziprasidone on bipolar? So ziprasidone is a good medication. It works well. It's got a couple problems with it. One is that it can cause what's called QTC prolongation, and meaning that you might need a EKG just to monitor it. The second, it has to be taken twice a day instead of once a day, so that makes it harder. And then thirdly, it has to be taken with food for the full absorption. But if those things are taken care of, then yeah, Zoloft or ziprasidone can be a good option. There. Dishwashers are like a game of Tetris. You gotta figure out how to angle stuff appropriately for the best, to fit everything in there. Excellent. Okay. We got everything in. Are you married? Yeah, I'm married to the game. Okay, perfect. We got the dishwasher rolling. Okay, so yeah, it looks like we got 131 people in here. So yeah, I hope this has been helpful. We just finished our lunch. So right now I'm about to go and get a haircut, and then I'm gonna work more on my coaching program. I have a couple videos I wanna record. Might record some TikTok content as well. I have a bunch of patients I'm seeing tomorrow, so I'm gonna get ready for that. But otherwise, I hope that this has been helpful. And yeah, if you're a PMHNP and you want to learn from me, best way to do that is through our coaching program. You can see that in my bio. And if you're a patient who wants to work with me and the best way to do that is to book a consult in my bio. Otherwise, I hope this has been helpful, and I will see you soon.